Now, if we compare the very small tumor, this happens to be a breast tumor, a few millimeters, we can see the very abnormal vessels that occur very early in tumor development. And Dr. Folkman, of course, theorized, and correctly so, that for a small tumor to progress from 2 or 3 millimeters to several centimeters, it has to incite this abnormal vascularity. And in fact, inside the tumor, there's areas of abnormal interstitial pressure and areas of focal ischemia. We can see this on the slide that as tumors grow, they have an increased interstitial pressure, which affects the vascularity in the tumor. So in the same tumor, we may be seeing different phases of vascularity. Now, color Doppler, I think, is helpful in looking at vessel density and arrangement in morphologically suspicious areas, and less important are the actual impedance and velocities. And with 3D, we can depict the vessel density, which I'll refer to later in the talk, and quantify this very important parameter. So what color Doppler is very good at is telling us what the physiology is involved with the normal ovary and ovaries that contain masses. And of course, where there's no follicular development, the vessels are very tightly coiled, and the impedance value is very high, as opposed to areas where there's a vascular arcade in a corpus luteum, where there's increased diastolic flow. We can see this visually here in this mature follicle, where there's vascularity around the periphery and a hypovascular space, which is an area where ovulation is going to occur. After ovulation occurs, there's formation of a corpus luteum. And again, as I mentioned, there's low impedance flow resulting from the corpus luteum, and the wall of the corpus luteum, the vessels, give a very low impedance value. And with power Doppler, we're beginning to see the branches, the small branches, from the wall in a corpus luteum, as shown here. And anatomically shown here is these very tiny vessels in the wall of a corpus luteum. Now, how to quantitate these vessels has been a subject of interest in several different studies. And basically, it's been shown that there is no magic value of RI or PI to determine if something is benign or malignant. And our study and others have shown that if we look at an ROC curve, receiver operating curve, our data shows that approximately a PI of 1.0 shows areas of about 80% accuracy. We can look at other parameters, whether the vessels are central or peripheral, and of course tumors have a more common central distribution of vessels. The systolic velocities are difficult to determine since we can't see the vessels in their entirety, and it's very hard to see exactly what the angle is. The impedance values are helpful, and the notch is really not. And when we put all these together, we come up with ROC values, but it gets very complicated, and we really need something a little bit more simple in describing benign versus malignant color Doppler features. We must remember that morphology is important. Morphology or shape is important. There's a big difference between these two individuals, and it's based on their morphology. Now, when we look at benign versus malignant, we know that smooth-walled structures are probably benign. Papillary excrescence, muronodules, and irregular solid masses are most likely malignant. And when we add color Doppler to that, the more regularly spaced vessels are more commonly benign, impedance high in benign lesions, and velocities are typically lower. And of course, changes in size is important. We should make sure that the mass indeed is still present after 1 or 2 cycles and not a physiologic mass. And finally, we need to know whether or not there's ascites, liver masses, or lymphadenopathy. So I want to show, rather than going over these specific guidelines, and they are guidelines, they're not certainly written in stone anywhere, some examples of what I've seen with color Doppler and ovarian masses. This was one of the first cancers we found. This is about a 2 by 3 centimeter ovary with an irregular solid area. Based on morphology, of course, one would be concerned about this lesion. And we could see that it extended into the fallopian tube on the left here. And here's the operative specimen with the tube clamped by the hemostat. And in low power microscopy, you can see that these are all very abnormal vessels surrounding the epithelial ovarian cancer. This is another patient that was being followed for follicular monitoring. There are 2 cysts, 2 follicles here, and in this area of the ovary there's a solid irregular papillary excrescence with a big blood vessel that has low impedance. And this was a stage 1 ovarian cancer, and this is the low power showing the abnormal proliferation of epithelial cells shown in purple in this ovarian cancer. Now, morphologically, this lesion has some suspicious characteristics. There's irregular wall thickening, there's an area of focal calcification, and in the wall itself we can see abnormal blood flow. This blood flow shows probably from vessels such as this that have no muscular media. Now, what was more concerning to me was the cluster of vessels right here surrounding the lesion, and these are associated with arterioles that are infiltrative in the fallopian tube in this ovarian cancer. This is a patient that presented for uterine bleeding, and we can see that there's a big solid mass with low impedance flow, and this is typical of a clear cell carcinoma. This patient has a cystic area in this ovary as well as this papillary excrescence. Now, most of the time papillary excrescences are associated with malignancy or borderline tumors, and we can see blood vessels in the papillary excrescence, which histologically it conforms to this on low power and on high power as areas of vascular infiltration by this papillary cancer. Now, we can differentiate cancers from benign lesions by showing that the lesion does not have any significant central blood flow, such as in this corpus luteum and such as in this hemorrhagic cyst that we can see has some fine linear interfaces inside the hemorrhagic mass, and this is characteristic of hemorrhage. And we can also differentiate tumors from non-tumors. This is a peritoneal cyst by showing no vascularity